Good morning, panel. The prevalent issue of antibiotic-resistant bacteria has become a hindrance in treating bacterial diseases. Specifically, Pseudomonas aeruginosa, which is according to the fact sheet of Center for Disease Control in 2019, has a serious threat level. In this slide, you can see how it affects us. It has 32,600 cases, 2,700 deaths, and about 757 million cost of damages. Now, Pseudomonas aeruginosa infection has 4 examples. It affects immunocompromised patients, pneumonia, urinary tract infections, and bloodstream infections. This research, we would like to take a step in addressing this issue by researching into Quercus oletorius as an antibacterial agent against Pseudomonas aeruginosa. We have chosen saluyot to be studied because it is a common plant, especially in tropical countries. First, it has leaves are nutritionally the best. Second, it has antibacterial and antifungal properties, which will be discussed next in my slides. Then also, it is commonly found in the tropical countries such as Philippines. Thus, our research title is In Vitro Phytochemical Screening and Antibacterial Property of Quercus oletorius against Pseudomonas aeruginosa. Now, these are the questions we would like to be answered at the end of our study. First, what are the phytochemicals present in Quercus oletorius leaf extract? Then second, what are the mean zones of inhibition of Quercus leaf extract, positive control and negative control against Pseudomonas aeruginosa? Then third, is there a significant difference on the mean zones of inhibition of Quercus oletorius leaf extract, positive control and negative control against Pseudomonas aeruginosa? Fourth, is Quercus leaf extract a potential antibacterial agent against Pseudomonas aeruginosa? Now, for the methods used in our proposal. So this is the flowchart of our study. First is the collection of Quercus oletorius. Then next is the preparation and extraction of Quercus oletorius. Then next to it is the phytochemical screening, which we expect flavonoids, alkaloids, phenolics, and also LCMS. Then the antibacterial test against Pseudomonas aeruginosa. Now for the collection of the Quercus oletorius. First is will be bought from a plant vendor or some in the market since this is abundant in a tropical country. Then next, it will be thoroughly cleaned. Then also, it will be ground to powder form. Now for the preparation and extraction. There's a sample of 100 grams of fresh leaves will be macerated using 500 ml of 95% ethyl alcohol. Then next to it is the extract will be concentrated using a rotary evaporator. Now, for the phytochemical screening, the phytochemical screening for alkaloid, a 1 ml of the filtrate will be subjected to Meyer's reagent and Dragendorf's reagent. The turbidity or precipitation will be taken as evidence for the presence of alkaloids, as what we've seen in the other D. Now, for the phytochemical screening for phenolics. First is the ferric chloride test. 2% of the ferric chloride solution will be mixed with crude extract. Then, the black or blue-green color will indicate the presence of tannins or phenols. Then now, for the phytochemical screening for flavonoid. About 3 ml of diluted ammonia will be added to 2 ml aqueous filtrate. Then 1 ml concentrated sulfuric acid. Then the yellow coloration in each extract will show the presence of flavonoids. So, now, after the phytochemical screening, we'll put it in the high-performance liquid chromatography technique, or HPLC. Then we will inject 20 microliters of the plant extract to the machine, then use the liquid chromatography mass spectrometry technique. Another for the antibacterial test against Pseudomonas aeruginosa. For antibacterial test, we will use the agar diffusion assay. The concentration of extract is 100 mg per ml. So in the positive control, we will use tetracycline, and also for the negative control, we will use the placebo drug. And that ends my presentation on my proposal. Then, any questions?